Hello, I'm Kate Jones. I'm Chief Operating Officer of one of the local clinical research networks with the NIHR. I'd like to introduce you to Terry.
Hello, I'm Terry Salt. I'm the Interim Head of Hospital for North London, working and regulating the acute hospitals within that area.
I'd like to introduce you to Paul.
Hello, my name is Paul Charlton. I'm a member of the public. I have been involved as a carer in the main, but also as somebody with quite a personal experience of ill health. I've been involved with health research myself now for about 10 years.
Thank you. I'd like to introduce you to Keith.
And I'm Keith Wilson, a patient research ambassador and a full-time rep at Liverpool Heart and Chest Hospital.
Okay, so we're just going to have a chat today, and we're going to have look at a couple of questions. And the first one we're going to look at is, why is it important to include clinical research in the CQC well-led inspection? And I'm first going to go to Terry as CQC representative. Why is it important to you?
I think it's important for several reasons, but I think it's also important not just to look at it in isolation as part of the well-led. I think good research pervades all levels of a trust, all levels of hospitals, and all levels of patient care, and that we need to consider it in the core service inspections and probably in our primary medical service inspections, looking at community research. It's important because there's a strong correlation between good research and well-governed research and outcomes for patients. It sits very neatly along the quality improvement agenda, so trusts that are perhaps very focused on quality improvement tend also to be those that support and develop research, not just in the laboratories, not just in the research centres of universities, but on wards in departments working with all grades of staff to improve patient outcomes.
Keith, would you like to comment on that?
I think what Terry said is completely true, but from my point of view, now it's part of the CQC assessment, it will have to be driven by the chief executives, the board, so there's continuity throughout the whole organisation. And rather than it be fragmented, which it is in many organisations, research is a separate entity to the general care. We all appreciate that research is part and parcel of good care, and this will have to be driven by the organisation rather than individuals within that organisation.
Paul?
In some ways, this is a very straightforward and very simple question. Why on earth would I want to go to a hospital unless I was certain that the care that I was going to be receiving, or my children were going to be receiving, was supported by evidence? Research is just a component of healthcare, and in some ways it's really surprising that we're only now talking about asking hospitals, what are you doing in the way of research? How is it that your organisation is working? Is it systematically organised in a way that allows all your staff to belong to this wonderful world, which is health research? It's such a happy place. It really is. To have health research stimulating you, asking you all the time, should I be doing something the same? Is that really working? Are babies with orange hats a good idea to have on my ward because we are identifying perhaps that there's a question around their health and well-being? Wonderful.
So from our point of view, I think in the NIHR, this is a fabulous opportunity for us, because it gives research the level of importance that it needs at the board level. Now we've been really kind of promoting this for a long time, saying that it should be part of an organisation's strategy, not just a research strategy that sits on the side. It should be embedded within the whole improvement strategy for an organisation, for a health economy actually, and that it should be part of day-to-day practice. You know, as someone comes into hospital, what is wrong with them, what diagnostics do we need to do, and are they eligible for research? It is their constitutional right to have the opportunity to take part in research, and we do rely on the CQC to uphold the constitutional right in the NHS. So I think it's really important. Have you got anything that stimulates you to think about as a follow-up, Terry?
Yeah, I think actually For our inspection teams, it's a new area to look at. I think we need to develop confidence in looking at research and understanding the processes around research and the impact. Because I think a lot of people, inspectors and inspection managers included, don't necessarily see research as something that they know about or that necessarily impacts on everyday life. But if you actually look back in history a little bit to say Edward Jenner, how many people would not be alive today? How many more people would have died of smallpox if you hadn't been brave enough to actually develop that research? And then moving forward, actually, how many children with cystic fibrosis wouldn't be living into adulthood unless trusts developed good research and good involvement of patients and families in caring for those children, and for those of us with daughters. Actually, very recently, the research around the HPV vaccine and cervical cancer is going to be transformational in the number of young women that no longer are at risk of cervical cancer. I think when you actually look at the reality of what research does personally to each and every one of us, we begin to understand the scale and the scope of research and how it should and does impact on every single patient. So I think it's something we need to think about, the systems of how we look at it, but we also need to understand the impact.
Keith, can I just ask you, in terms of your constitutional right as a patient to have research considered as part of your pathway of care, as part of your care programme, what does that mean to you?
Well, I think research brings good practice and good care. Without research, we wouldn't get tomorrow's treatments today. We will always be behind. And I think this is one of the issues, that we separate research from good quality care. You wouldn't have good quality care unless we had the research to show it was better than what we had previous. So the misconception that research and good care is separate is wrong. And now with this assessment through the CQC, it's just one word. It is quality care. It is not 2 words, it's not 3 words, it's just about people having the opportunity to be treated with the most up-to-date quality care there is, and it will not happen unless we all embrace research.
So what does that mean to you, really, Paul? I mean, in terms of the opportunities that this gives to yourself and your family?
Being involved in this project and the development of the research question for CQC inspection and how that's to be measured, how that's to be described, it's been clear to me that this should be happening everywhere. So this is a universal question for all of the NHS. It may be the case that it's happening well in my hospital, but I want to know if it's not happening well somewhere else. Therefore, it's important as a member of the public to have reassurance wherever you are through the CQC that the research that underpins and delivers better care for me and my children is actually happening everywhere. So it's a question of fairness, it's a question of equity, it's a question of making sure that the constitutional right that you say, or that is within the NHS, is actually delivered in a way which just is automatic. So when I approach my hospital, I just see NHS and research service. The two sit together, and that's in every hospital.
And we've talked a lot about hospitals, but of course the CQC don't just inspect hospitals, they inspect anywhere where care is given to NHS patients. And I think that is really, really important as well, that research needs to spread out from what we consider to be centres of excellence to actually anywhere at point of care. And it is as well, we've got some fantastic research taking place in primary care, and in nursing homes and in social care, but we need to work with you guys to make sure that it's of the best quality.
And I think going forward, as complex care pathways develop more, where patients are cared for by a number of providers for the same condition, where the local sustainability and transformation plans are put in place, it's going to be more important that we as a regulator understand and see the bigger picture, that actually it isn't just the large university hospitals that do research.
Absolutely. Keith, can I just ask you, how can trusts promote patient and public awareness of research?
I think the most important thing is to acknowledge when we do things right and advertise the fact and show the benefits of research. There seems to be a lot of criticism when research goes wrong, and everyone can highlight different examples where it's gone wrong. But I think that if organisations and the NHS in general promote what we do well and show the benefits of quality research, that becomes the norm for everyday care and not something that's a one-off. This is consistent. The more people appreciate the value of quality research, the more they're likely to embrace it, and it becomes the norm for everyone, including all members of staff.
One of the pieces of evidence that were brought to the project on CQC inspection was around women's health.
Mm-hmm.
I have 5 daughters. I'm fairly interested in women's health. And there's one son, the youngest, Oscar. However, one of the most persuasive pieces of evidence for me, and I would felt quite angry about it really, because of having all these daughters, is that departments and concerned with women's health that would involve in research any particular study, I can't remember the specific area of the study, the particular area of reproductive health, but what this study was able to establish is that there was an overall increase in women's health generally by 15%. In terms of the difference between hospitals where women's health was part of the research activity, well, that's stunning.
Whether they were in the trial or not.
Whether they were in the trial or not.
And whether they
Why
were
on
receiving
earth
compensation.
would I trust a hospital, which my children were going to, or other NHS establishment, where their health was concerned, from a reproductive point of view, if that wasn't involved in research? 15% margin of difference is enormous.
It is. So in terms of the NIHR do a survey with their patients in all their organisations. It's a survey that we're promoting and hoping to get more and more responses to. But one of the areas that we ask about is, were you aware that your organisation was research active? And disappointingly, the response on that is much less than we would prefer it to be. So the awareness of patients going into any organisation that is actually research active, is actually much smaller than we would like. Have you got a view on how we could improve that?
Shall I have a go?
Yes, please do.
I think that's, if you like to use that sort of democratisation of research. Research should be present, and the opportunity should be present everywhere across the whole of the NHS as an organisation. But also we have to look at where research takes place at the moment and who leads it at the moment. So largely these are studies which are led by senior clinicians, whereas in fact the point of healthcare is a nurse-patient interaction. So the CQC will be instrumental in actually asking questions about to what extent is research democratically shared across organisations, to what extent are nurse practitioners, physiotherapists, occupational health practitioners involved themselves in their own nurse-led research. And that will create, I'm sure in years to come, a tremendous improvement in care.
I think Paul's right, but it's not just about patients being aware of research, it's all members of staff being aware of research. If the organisation, they keep saying this, it is not about one section or the other, it needs to be holistically done so everybody knows about research. Not every item of research, but just research in general. How can you expect staff to promote research if they know very little themselves?
That's a very good point.